Welcome, everyone. It is such an honor to be here, and it's exciting after all this time of planning. And if Victor hadn't mentioned it, I was going to give you a pop quiz, which is what's been the #1 report out of the National Academy of Medicine, National Academies of Sciences. And if you got the answer right, you get to stay. Okay? So good afternoon. I say good morning because we have over 3,000 people online watching us as well. So good morning to our colleagues in Hawaii. How's that? So I'm delighted to be here for 2 years at the National Academy of Medicine as the Senior Scholar in Residence and Senior Advisor to the President on Nursing at the National Academy of Medicine. And before we envision the future, I want to take a look back over the past decade and the roadmap that has brought us here today. There we go. Let me see. I should have figured out this clicker header. There we go. Okay. So Victor already alluded to some of these things, but in 2008, the Robert Wood Johnson Foundation, the nation's largest health and healthcare philanthropy, approached the then-named Institute of Medicine to propose a partnership between the two organizations to assess and respond to the need to transform the nursing profession to meet the challenges facing our country. Health reform was at the forefront at the national agenda the last time we were here. And the Robert Wood Johnson Foundation believed that nurses, as the largest component of the healthcare workforce and the most trusted, who spend the most time with people, family, and communities, could fill new and expanded roles in care coordination, health promotion, and quality improvement. The Robert Wood Johnson Foundation, on the initiative of Future of Nursing at the IOM, was tasked with examining the capacity of the nursing workforce to meet the demands of a reformed healthcare and public health system. It was told to develop a set of bold national recommendations, including ones that address the delivery of nursing services in a shortage environment and the capacity of the nursing education system. Donna Shalala, now a U.S. Congresswoman from Florida, we all know that now, and previously the Secretary of Health and Human Services, and Linda Burns Bolton, as Vice Chair, served as leads for the committee. An extraordinary group of professionals convened and came out with, I think you would agree, a robust set of recommendations. So here it is, again. The report released in 2010 catalyzed the nursing field in a very big way and served as the roadmap for nursing's future. The report stated that nursing must be prepared for healthcare transformation and that nurses must help to lead and shape this change. The report offered a series of recommendations to prepare the nursing workforce for the 21st century. The recommendations sought significant improvement in public and institutional policies at all levels. The report contained 4 messages with 7 overarching recommendations to build the capacity of the nursing workforce. The report stated that nurses should be able to practice to the full extent of their education and training. The committee felt that nurses had great potential to lead innovative strategies to improve the healthcare system. However, a variety of historical, regulatory, and policy barriers that we're all familiar with limited nurses' ability to generate widespread transformation. As a result of the report, recommended the removal of scope of practice barriers. The second key message was that nursing education needed to be strengthened. The committee felt that the major changes in the U.S. healthcare system and practice environment required profound changes in the education of nurses both before and after they received their licenses. The committee made 4 recommendations in the area of nursing education: to increase the proportion of nurses with a BSN degree to 80% by 2020, the infamous 80-20 recommendation; to double the number of nurses with a doctorate by 2020, to implement nurse residency programs, and to ensure that all nurses engage in lifelong learning. The third key message was the need to transform nursing leadership. The committee felt that a transformed health system would require nurses to take on new roles in new settings, and that nurses would need to see policy as something that they shaped, rather something happening to them. More nurses needed to have a voice in health policy decision-making, and more nurses should serve on advisory committees, commissions, boards, and all places where policies are being made. The committee specifically recommended that we expand opportunities for nurses to lead and diffuse collaborative improvement efforts, and that we prepare and enable nurses to lead change to advance health, which became the title of the report. The fourth key message addressed the need for better data on the healthcare workforce. The committee felt that planning for the changes necessary to achieve a reformed healthcare system required a systematic understanding of the numbers and composition of the healthcare workforce, including projections of future workforce needs, and major gaps in the available workforce data needed to be addressed. So the goal. The 2010 report offered a clarion call to action for the nursing community and all of its partners, all of you here today and all of you tuning in on the web, to build the capacity of the nursing workforce. The report also spoke to fostering interprofessional collaboration and improving workforce diversity. Building capacity of the nursing workforce would ensure that all nurses were prepared to lead change and advance health. And then here it is, this wonderful partnership that evolved. Robert Wood Johnson Foundation did not want this report to sit on a shelf and collect dust. No way. And we thought that the best way to advance the recommendation was to partner with an organization focused on consumer health, because we believe that even though the report was about capacity building in the nursing workforce, it was, after all, about consumer health, was it not? We turned to AARP, the nation's top consumer organization, and asked them to form a nationwide initiative with us. We launched the Future of Nursing Campaign for Action in late 2010. At the same time, we launched the first report. The IOM report became a blueprint that galvanized the nursing community and a broad spectrum of partners inside and outside of healthcare. And I'm so incredibly proud of all of you in this room and online and more who have been on this journey with us. Robert Wood Johnson Foundation launched and funded numerous other programs in addition to the report and our relationship with AARP. You'll see them in the boxes on the screen. We also funded 5 eminent nurse researchers throughout the campaign to work on research germane to one or more of the nursing recommendations. For the campaign's 5-year anniversary, we asked the National Academy of Medicine again to evaluate our progress in moving the recommendations forward. And you can see, as Dr. Zhao pointed out, some of the overarching recommendations that came back from that midterm report, that we needed to, yes, we had nurses, and we still have nurses, but we need to continue to build a broader coalition amongst many other professions and sectors. We need to ramp up our diversity efforts always, and we need to gather better data to assess and drive and measure our progress. So in other words, well, I'm out of slides. I didn't mean to click it, but it wouldn't go back. So you'll have to pretend the slide is up there. In other words, the campaign has done, there it is, thank you, from above. The campaign has done a great job of reaching nurses, but we need to reach many others. Now I'm going to turn things over to my colleague, Susan Reinhardt. I stepped back in time a bit to talk about the report and our past. And Susan is here to talk about the campaign and all of the successes. And then we will have Dr. Paul Kinnert coming here from Robert Wood Johnson Foundation, who will have a presentation of the statement of tasks for this committee, at which time the committee will then be able to ask questions. So Susan, thank you.
Great.